Hi, I'm Dr. Jameson Spencer. I'm going to talk today about the Easy Airway oral appliance. This appliance is used to keep the jaw slightly forward in a slightly protruded position, or to keep the jaw from falling back, obstructing the airway. The design behind this appliance is that it is fit using a dental putty material. I will go through in a minute exactly how to fit this. As you'll see, it's very simple, very easy to fit, and very comfortable for the patient. The idea behind the Easy Airway is that it can be fit pre-operatively on a patient who's at risk for their airway collapsing or having obstructive apnea events. The appliance is FDA approved for the treatment of snoring and sleep apnea. But again, in this application, we're looking at a patient who perhaps has not had diagnosis of sleep apnea at this point in a perioperative setting. They've been screened. They are believed to be at risk for obstructive sleep apnea or airway collapse, and we want to do something in an immediate type nature in order to protect their airway immediately after the surgery, and perhaps even for that patient to use for days or even weeks post-surgery, to use when they're asleep, or to use at any time where they may fall asleep, and therefore protect their airway by using that appliance. The appliance could be used for a temporary or trial period after that surgery, while we're trying to get that patient into the sleep lab for accurate diagnosis and ultimately definitive treatment of their obstructive sleep apnea if they are shown indeed to have that. So going through some of this, this is the tray for the appliance. This is a plastic material that is very soft, very flexible, and we will be putting that in the mouth. After fitting it with a dental putty material, it will then set in a matter of minutes, and that will keep the jaw from falling backwards. To find the correct jaw position, the nice thing about the Easy Airway being fit with the patient awake is we are not going to be protruding their jaw into an uncomfortable position, whereas if they were sedated during this procedure, we might bring their jaw in a position that they would never be able to do when they're awake, put terrible strain on their jaw joints, maybe even cause an injury. With doing this in the preoperative setting, we know that the patient's going to be able to tolerate the appliance because we will actually fit it with them awake, and we'll fit it in a position that they can tolerate preoperatively. We have different gauges that are part of this kit that will help us determine the correct position. These go anywhere from end to end, or just slightly protruded, to 6 millimeters past end to end. And we have 4 different gauges, so 0 or end to end, +2, +4, and +6. For someone with a large overjet, you can also flip these over, and it would be -2, -4, and -6. Those numbers being relative maxillary position to mandibular position. So if someone did have a large overjet, 0 may be too far forward for them, so maybe a -2, -4 would be an appropriate position. Let me show you how those work. We have the patient open, put the little groove on the top teeth, close. Bring your jaw back a little bit, and there's another groove, and that would be an end-to-end position. Is that comfortable? Yes. Yeah, that's an okay position. So it'd be easy for most patients to go that position. What we want to do in the preoperative setting is find out how far the patient can go forward. So that was 0. Okay. Is that okay there? That's +2, open. This is +4. Bring your jaw forward, click. Okay, so that's 4 millimeters. Starting to feel a little strain there, a little bit open. And let's try the +6, see if she can even do it. Jaw way forward, click, and gets to the +6. And how about that? Is that pretty uncomfortable? Yeah. Okay, thank you. Open. And let's go back here to the +4 right there. And although that may cause a little bit of jaw tension right there, that's probably going to be a fine position for a temporary basis. Let's do another way to test this. Open for me. So I'm going to have you make a little bit of a noise in the back of your throat, kind of a snoring noise. Go ahead and do that for me. Okay, close. Okay, try to make that noise again. Okay, that is slightly more difficult. I'm going to go to the +2 position now. Do that same noise. Okay, that is much more difficult. Let's go to the +4. And again, and can't make it at all. So we're going to go ahead and use that position. That obviously opens the airway when she's sitting up awake, but that should also be a good position for when she's post-surgical, post-sedation on some pain management, some narcotic pain relievers or whatever the case may be post-operatively, where there's going to be less of a drive for her to breathe, and we just have these potential problems with airway collapse. So we're going to do this +4 position. Again, these gauges come with the kit. They're disposable, so this would be used in each patient to determine the position preoperatively. Also, you're going to be aware that that was a position preoperatively that did not cause undue discomfort, that did not cause no significant trauma or anything like that to the jaws, as a position that the patient could tolerate. Okay, the material that is used is a vinyl polysiloxane. And on this video, obviously, we're doing everything in real time, so you'll see exactly how long it takes to fit this. The putty will come in the kits in individual dosing, but I just show this here as it is in our dental setting. So in the actual kit that you would receive, these will be pre-dosed for the proper amount. So it starts off as 2 little balls of putty. And what we're going to do is mix these together until it is a homogeneous color. And once I have that homogeneosity, then I'm going to put it into the tray and fit the tray in the mouth using that bite stick to position the jaw. So I'm going to go ahead and do that. Work pretty quickly. The setting time on this is just a few minutes. You have about a minute or a little bit over a minute working time to get it as homogeneous as you can. That is